and welcome to another beautiful role play. Now, this role play is for pharmacist, isn't it?
Yes.
Well, in this role play, the pharmacist is trying to explain the patient that he has given the right drug. This is because the patient is really concerned and angry, thinking that the pharmacist has given him a wrong medication 2 days ago. Now, Anu, she's going to take the position of the pharmacist, and I'll be taking the position of the patient.
Good morning.
Good morning.
My name is Anu, a registered pharmacist working in this community pharmacy. May I know your name, please?
My name is Bindya.
Okay, Miss Bindya, I can see that you're a bit concerned about something. Would you mind telling me what is the reason behind that?
Yes, pharmacist. Indeed, I'm upset. This is because I understand that you have given me wrong medication 2 days ago, and I'm really unhappy about it.
Okay, I can understand that you have misunderstood that I have dispensed a wrong medication to you. And I just want to know, how do you believe that I have made an error while dispensing this drug?
Well, let me tell you. Well, 2 days ago, I went to my doctor because I was having a hard time sleeping, and he gave me a medication. Okay. I collected the medication from you, and I went back home taking the medication for 2 days. Now, today, my daughter, who herself is a nurse, handed me her drug book. That's when I learned that I have been taking a medication for depression and not for my sleeping problems. I'm really worried about it, pharmacist.
See, Ms. Bindya, I can totally understand your worries that you have read from a drug book that this medication is classified as an antidepressant drug, right?
Oh, yes.
And I just want to know that how this medication is working on you.
Well, this medication is working really well, like a miracle. But that's not my concern. You have given me a wrong medication, and I'm not happy at all.
See, Ms. Bindya, I'm glad to hear that this medication is working on you properly. Is that correct?
Oh, yes.
Okay, well, I can explain you why the doctor has prescribed this medication for you. As this medication is classified as an antidepressant effects, it's well working on its sedative effects of its lower doses. That your doctor has been prescribed Celexa in a 5 mg in its lower doses, and it is very suitable for your disease condition. And now I can sense that you're not clarified with my point. Is that true?
Well, yes, pharmacist. Right off now, I think that you're trying to cover up your mistake, and I don't want you to do that. Just give me the right drug.
Okay, I can totally understand your anxiety, and it's quite reasonable. And now, if necessary, I can prove you by showing the prescription what the doctor has been prescribed to you. So this is the prescription and this is the medication. Here in the prescription, you can see that the Celexa, which is given in a 5 mg doses, and this is the dispensed drug which I've given to you. It is also in the same dose. So by seeing this, you can see that I've done the right job, that you have given the right medication for your disease condition. And now, how does that sound?
Well, I trust you right off now.
Okay.
Okay, but I really don't understand. Why did the doctor give me an antidepressant medication when I'm not depressed?
Okay, see, Miss Bindya, I can explain you in a better way that, as I've told you earlier, this is classified as an antidepressant effect, but it is well working on its sleeping difficulties in its lower doses. And for the depressive patient, it is given in a higher doses. And I can reassure you that this medication is going to work well on your disease condition. Is that point clear to you?
Oh, yes, pharmacist. Well, right off now, things are much clearer and I'm quite relaxed.
Okay, glad to hear that I've cleared all your doubts. And do you have any other concerns?
No, pharmacist. In fact, sorry for bothering you.
That's okay. In that case, I think that I've cleared all your points. And if you have any other doubts, please don't hesitate to contact me.
Sure, pharmacist.
Thank you.
Thank you once again. Well, Anu, you really did a good job in convincing the patient.
Thank you, ma'am.
Well, I think this role play is also a very good thing for all the students, not only for the pharmacist, to check on, because there's a lot of arguments happening, a lot of things happening over there where the pharmacist is convincing the patient. So I think it's going to help everyone.
Yes, ma'am.
Okay. Well, I think it's better for all of you to check into this role play, and I'm sure it is going to help you. Thank you.
Thank you.